So here we go. For those of you who don't know Laurel Wilson, she is a perinatal expert, author, TEDx and international perinatal and women's health speaker. She is the co-author of the best-selling books, The Greatest Pregnancy Ever, The Keys to the Mother-Baby Bond, and The Attachment Pregnancy, The Ultimate Guide to Bonding with Your Baby. She's also a contributing author to Round the Circle, Experienced Doulas Share What They Learned the Hard Way, and original editor of the Kappa Lactation Education Educator Manual. She served as the Kappa Executive Director of Lactation Programs for 16 years and is now on the Senior Advisory Board. She served the board for the United States Breastfeeding Committee from 2016 to 2019 and currently serves on Enjoy Health Review Board. So Laurel is a board certified lactation consultant, childbirth educator, labor doula, lactation educator, prenatal parenting instructor, and pre and postpartum fitness educator with over 26 years of experience working with women in the childbearing years and also with perinatal professionals. She owns Mother Journey, which is on Instagram. I believe is Mother Journey Laurel Wilson. She can confirm that to us in a moment, which is based in Morrison, Colorado. I actually met Laurel during my training with the amazing Lindsay Hookway from the Holistic Sleep Coaching Program, and I've been following her work since then. And as you can see, she has a lot of experience. She's amazing, and I'm sure you're all going to feel the same after you hear her chat today. So let's see if we can invite Laurel to join us. There we go. If anyone has any questions, we did receive an overwhelming number of questions and we'll be trying to get through them all. Hello, Laurel.
Hi
Lovely
there,
to see
how are you?
I'm good, thank you. Lovely to see you, nice to speak to you. Thank you so much for coming. So I'm just saying to them, I did send you the questions. You know, we have a lot of questions. So I think it was over 50 questions that we received. So we'll try to get through them. But if anyone has any other questions that they want to send in the live chat, I'll try to go through them as Laurel is speaking. And hopefully we'll have time to go back to them after. So did you have anything else that you wanted to say before we jump into the questions, Laurel?
I just want to send, giant hugs out to the community. I know that so many families are really struggling with what's going on right now. So I hope that we can provide some information that can provide some familial peace and personal peace. So because often when you have information, it feels a lot easier to deal with. So I'm sending big hugs to everyone at the beginning of this interview.
Yeah, that's great. And obviously if it's evidence-based information, because sometimes we just read so much and it actually makes us feel more anxious. And as we know, pregnancy is already a time of so much anxiety. And, I'm pregnant at the moment, so I have my own concerns. And, without even starting to talk about COVID-19, it's already overwhelming. So we can understand how pregnant women might be feeling at this time, and new mothers as well.
Yes.
So let's jump into the question. So what I'm actually doing is I've split them into 3 different categories, actually 4. So we'll go through the different stages. The first, I'll ask you the questions about pregnancy, and then we'll go through birth, and then the postpartum period. And I also have some questions from doulas, which I'll leave to the end. So if people are not interested in that part, they can leave before. Right. So pregnancy. First question I have is, so why have pregnant women been put in a higher risk group if there have been no serious cases or deaths involving pregnant women? So over to you, Laura.
So so there are a few reasons why women who are pregnant may be in a higher risk category. One of them is because during pregnancy, you have an increased heart rate, and also you're using more oxygen consumption. And as we know right now, this is a respiratory virus, and it requires, it can rob us of our ability to utilize oxygen effectively. So the thought around that is that there may be increased risk for that. There's also tends to be decreased lung capacity overall, because as the baby grows, it's taking up space within the body. So that could be an issue with the ability to breathe effectively. And the other thing is that during pregnancy, there's a shift away from what we call cell mediated immunity. And what we saw with SARS and MERS is that there was an increased risk of illness and morbidity during pregnancy. We have not seen that this time with this particular virus, but the data has been very slow to come out. But there's just a suspicion, because of past history, that there may be some potential risk to pregnant individuals. And that is why it's very important for pregnant people to take as much care as they possibly can to socially distance, stay the 6 feet away, wash their hands as often as they, possibly can before and after eating, and when they come inside, after shopping, things of that nature.
Right. Can I just ask everyone who's listening to us whether they can hear and see us okay? Because I can hear cutting, so I'm not sure if everyone is going through the same thing. Whether my audio is also fine and my picture is fine. So if anyone could let us know if they can see and hear us, that would be great. On to the next one. And there seems to be a delay of my voice getting to you as well, Laura, I believe. Let's go to the next question then. So if I have a pregnancy complication, will I still be seen by someone?
Okay, yeah, you're cutting off for me too. I think that
yours. Is that any better?
Yes, I can hear you better now. Can you hear me better?
Yes. Let's see if that works.
Okay.
Did you hear my question at all?
I heard the beginning, but not the end of it. If you could read.
So if I have a pregnancy complication, will I still be seen by someone?
So you should be able to still see your care providers, although the majority of healthcare providers are asking to do as much as they possibly can through telehealth options. There will absolutely be some visits that you have to go in for. For example, if you have to get a sonograph or ultrasound, you would have to go in. And there are certain visits where they will actually need you will need to be in person for them if you have to have a blood draw or take a test. But a lot of the visits will be moving to telehealth. If you do have an emergent situation, you absolutely should be able to be seen by your healthcare provider.
Actually, I do have quite a few questions about antenatal appointments, so I'm going to jump onto them. Because there are quite a lot of people concerned about, you know, whether they'll be cancelled, whether they'll be spaced out, or whether they'll be transferred now to telephone or internet, and it seems to be like that's what's going to happen. But also, if they are spaced out or if they are cancelled, which appointments are the completely essential ones that must not be missed at all?
Well, that's hard to say because it really depends on the health status of the pregnant person, which are going to be absolutely essential. And so that is really going to be something that will be navigated between the parent and her healthcare provider, which ones are essential in person and which ones they can certainly do at home. You know, most of the international organizations are recommending that we do telehealth as much as possible. But as I mentioned, again, there will be those that you will need to go in. For example, you know, if you are carrying multiples, you will likely be having scheduled ultrasounds throughout your pregnancy, and you will be required to go in for those visits. Now, best practice right now is asking that visits are scheduled spaced significantly. In-person visits are spaced significantly between one another so that families don't have to come in contact in waiting rooms, or they will be separated.
So that was actually another question. There was someone worried about going to appointments and having to wait in a waiting room full of other people, and what kind of precautions the hospitals are taking. So that's the sort of thing. They're booking them more spaced out.
More spaced out. They also are, most of them are having spaces where there is a space where people who are suspected or have been confirmed as having COVID will wait, and then there's a section for people who have not. So, you know, but the reality is that every hospital system and every healthcare provider is creating their own policies around this. So there are best practices, and then there's what's happening in reality. So my suggestion to every pregnant person is to be their own advocate. Get on the phone and ask. Ask before you come in what the protection measures are, so that if you feel most comfortable, you can wear gloves, you can wear personal protection, equipment, you can wear a mask, just so that you know you're going in more protected than otherwise.
Yes. Yeah. Okay. So that was one of the questions about the waiting rooms. There's another question about going to appointments in a clinic that is shared with COVID-19 testing, and whether that was safe.
So my understanding is the majority of those facilities are, that's why they're having everyone call immediately prior to their visit, because they're doing screening to find out if anyone are at a higher risk of suspected or confirmed illness. And if so, they're having them actually enter through a separate entrance. So they're trying to separate not only where you would wait, but even how you would go into the hospital to minimize exposure to pregnant people.
That's great. That's great. Right, so that I've asked that already about what's absolutely necessary. That's individual, as you said. There is someone here saying, I'm 20 weeks. I've got my 20-week scan. It has been postponed twice, and I'm 26 weeks now and concerned about baby. Are there things that I can check at home to make sure that the baby is fine?
Well, I mean, one is just to talk to your baby, communicate to your baby, talk to your baby throughout the day. You can also count fetal kicks. There are numerous pregnancy apps out there that help you identify fetal kicks, and you can log them so you know that your baby is active throughout the day. So those are a couple of things that you can do to stay connected to your baby. I'm a big fan of that mind-body connection and the fact that we are very connected to our babies and we can communicate to them. So I would just encourage that communication throughout your pregnancy. But fetal kicks are a good one to know that your baby is actively moving around and growing and doing its thing.
Especially at that stage, she's 26 weeks. So at that stage, you would be feeling kicks, wouldn't you?
Yeah, so that would generally be, 16 weeks is usually when a lot of people feel the first movement. So as the baby grows and takes up more space in the womb, you'd be more likely to feel the baby moving around.
Perfect. Is it still important to get the flu vaccine while being in isolation? So having to go to a hospital to get the flu vaccine during pregnancy?
It still is a recommendation that pregnant people do get vaccinated for the flu. And that's not going to reduce their risk of contracting COVID-19. But what it does do is reduce their risk of being compromised and contracting that in addition.
Right. Okay. I'm 11 weeks pregnant and I have asthma, and I'm classed as a key worker in a workplace that social distancing is not possible. Workers saying I'm not at risk. What should I do?
Well, that's really, that's a very difficult decision. That would put that individual in a higher risk category for morbidity and for significant illness, and put them at a higher risk for, if they contract the disease, for having to be hospitalized. So dependent on their personal and financial and familial situation, they may want to request to be furloughed. And it's very possible that they could talk to their doctor and get a note. Every country is a little different about the regulations for this. So my suggestion would be to make an appointment or do telehealth or send an email to your doctor explaining the situation and the concern and the fact they cannot be spaced effectively, and ask if they can get a note for furlough.
And again, it's not only the risk of getting the disease, but also spreading it, isn't it? Because you could be someone who's carrying it, and if you're not adhering to the social distancing, which is something that's being recommended by the government, then it's not safe, really.
Right.
Here in the UK, we're lucky to have any employed person is getting their salary paid by 80% of their salary paid by the government, so it's a great help. But obviously, this situation varies from country to country, and I'm sure a lot of families are feeling in this sort of situation now, that what do I do, because I need the money. So it's a difficult one.
Yes.
Right. Next question. Again, I've got another one, someone who's a health worker, so a key worker as well, and she's pregnant, and she's asking whether she should continue to go to work.
Yeah, again, that's going to have to be an individual decision, a personal decision, because and again, every country is regulating who's a key worker and the requirements about that separately. Yeah, so that'd be the same thing. I would have a conversation with my doctor, dependent on my risk status and the ability of personal protection equipment in the place that I'm working, and make a decision with my care provider as to whether or not I should continue going to work.
And actually, as a health worker, we don't know exactly what they're doing, do we? They could be someone who's very exposed to the virus, or someone who's not really. So it's very hard to know without knowing more details.
Right.
Do we have any data about coronavirus in early pregnancy?
Right now, I have not seen any published studies about contraction early on and the impact in pregnancy. So far, the majority of the information that's coming out is from China, and most of that is looking at the point of end-stage pregnancy and what happens for vertical transmission. So I've not seen any data yet for that. I understand that there are several more studies coming out of China to be published soon, but they have not hit the journals yet, so I can't comment on them.
No problem. Does the virus lead to a premature birth? And I think the reason people are concerned about that is because the few studies that we do have, I think we did have about, was it 9 cases that we did have of pregnant women with in China with the virus, and it was they did well. We don't know whether it was led to a premature birth. We don't know whether there is a correlation there, do we?
Exactly. Yeah, we can't identify at this time if if the virus puts the parent at risk of preterm delivery. We don't have enough data about that. There was a recent meta-analysis that looked at all of the deliveries that have been published so far. So they were looking at, I believe it was 36 pregnant people and 38 births, because there were some twins involved as well. And it doesn't look at this time as though there's a strong indication that way, but that's such a small sample, so we really can't say either way.
And what if a pregnant woman is, in the late stages of pregnancy, gets sick with the virus or suspected case of coronavirus? Is an induction appropriate? Is it recommended? Is there any data about that?
So again, that's a decision that's going to have to be based on the health status of the parent. What we know as birth professionals is that induction does significantly increase the risk of cesarean section. And cesarean section also has a whole host of health risks associated with it as well. However, I have seen some proposed policies in the United States that are suggesting that if someone is beyond 37 weeks and is suspected or confirmed of COVID, that they can, with their doctor, schedule an induction and or a scheduled cesarean section. Now, I haven't seen any of those policies put in action yet. They're all kind of in discussion at this point. And we do know that out of China, many of the pregnant parents who had COVID wound up with a cesarean section.
Right, yes, I've seen that. And we actually have a lot of questions about C-sections as well, whether it is a recommendation. And again, I think that comes from the fact that the data that we have from China, it was from cesarean sections, but so people are worried whether having a vaginal birth will lead to more chances of transmitting the virus, and whether C-section is recommended in that case.
So in some of the documentation I've been reading, the thought around scheduling a cesarean section has to do with if someone is in the early stages of the virus, that they know that it gets increasingly more risk, more morbidity, and more serious as the disease progresses. So the thought around scheduling a cesarean section is to get the baby out and born prior to when the symptoms kind of elevate. So that's my understanding, is that is the thinking around scheduling a cesarean section. I don't know that we really have the data enough right now to say if that's a good recommendation or not, because we know there's morbidity and risk with cesarean section as well. Plus there's increased time that the parent and baby will be separated. And, the World Health recommendation recommends keeping the parent and the baby together, but with personal protection. However, our Centers for Disease Control is recommending separation of the mother and baby if there is a virus. So, you know, that is a very regional thing, even though we do have some world guidance. So I think you're going to see from country to country that policies are going to be adopted a little bit differently depending on interpretation.
And also, I suppose with cesarean sections, there's also a chance that the mother and baby will be in hospital for longer. And as I understand, I'm not sure if it's a question, actually, I'm not sure if that's right, but as I understand, the ideal scenario would be to get mom and baby back home as soon as possible at the moment, because obviously hospital is a place that you have more chance to get exposed to the virus.
Right. So my understanding with that as well, in the few policies that I have had access to look at right now and some letters to the editor, is that they are recommending a return of the mother and baby, the couple, at home as soon as possible, within the first 24 hours if possible after vaginal delivery, and within by the second day with cesarean section, which is a very, very quick turnaround. But again, that they're trying to minimize the risk to the couplet. Now, that of course would change if there were any complications or additional needs for either the parent or the baby.
Sure. And there is a question here, actually, Laura, that just came live. If you have virus, is surgery C-section increase? I guess, does surgery C-section increase the risk of any complications?
There is a potential risk, because with any major surgery, you do run some risk. There are side effects of the surgery, and if you are in a higher risk category in general, for example, if you have any lung compromise or autoimmune, there may be more risk to that. So every individual person, they are going to have to take on a case-by-case basis to look at their personal history, their medical history, and the progression of the illness to determine whether it's safest to have a cesarean section or whether it is safest to go with a natural progression of labor.
Okay. I've got a question here live about home birth, but I do have a lot of questions about home birth, so I'll get back to that in a moment. Just going back to the pregnancy questions, regarding medications, they are asking, are the medications to treat the coronavirus safe in pregnancy? And I guess there isn't a specific medication to treat the coronavirus. So I'm not sure whether she's worried about, the medications that we usually use for colds and things like decongestants or ibuprofen and paracetamol, that sort of thing.
Right. Okay. So there's a couple layers to this. Right now, there is no treatment for COVID. There are some medications that are being used in trials. One of them is called remdesivir, and that medication was being trialed for treatment for Ebola virus, MERS, and SARS. And the Academy of Breastfeeding Medicine did publish an article about antivirals and human milk and their safety, but essentially we don't know very much about their safety. We do know that there was one baby who had contracted Ebola who did receive IV remdesivir and had no negative side effects from that treatment, but that is the only case we know of around remdesivir in an infant. We don't know how much of it actually winds up in human milk and what the oral availability, we know very little about that. So that's in the category of the actual medications to treat COVID, which we have none. In terms of medications that we would normally use to treat a cold. There are a variety of apps that they can use to look up the specific medication to determine its safety during breastfeeding and pregnancy. And you can find those on my website, motherjourney.com, on my social media page. There's a bunch of apps that parents can download, including medication apps, so they can look up each one individual, because there's so many, I can't really talk about each and every one.
Yes, of course.
And then there's also a concern about NSAIDs, things like ibuprofen. Now, there are certain NSAIDs that are used for very specific conditions during labor, and at this time, or for example, oh my goodness, it just slipped my mind. I want to say cortisol, but that's not what it is. Steroids, steroidal medications, which are not recommended right now, or anything that might aerosolize the virus. For example, using a, oh my gosh, sorry, my head's just going crazy right now.
That's okay.
But for example, a nebulizer, that's what I was trying to think of. So for individuals who may need those specific medications, or their newborns, right now hospitals are creating very specific protocols about the age of the baby at delivery, like if they're born very preterm or near term or late preterm, etc., and what's going on with them, and and whether or not that medication would be considered safer or unsafe. Sure. And right now, the World Health Organization says that they do not discourage the use of things like ibuprofen and Tylenol to treat.
Oh, that's interesting, because I was under the impression that ibuprofen wasn't recommended.
So in France, there was a recommendation that, out of a suspicion about the receptor sites, how ibuprofen can bind to certain receptor sites. However, there's no live data around that. It hasn't been put in any sort of research trials. It's more of kind of a suspicion. So it is a possibility. But right now, the World Health Organization has stated clearly that they are not discouraging the use at this time. However, some parents may feel more comfortable simply because that is a suspicion based on what we know about ibuprofen, though it's not been proven. They may feel more comfortable using paracetamol or what we call Tylenol.
Sure. Okay. So I've got someone here who is saying she's due next week and have started coughing. It's a phlegmy cough rather than a dry cough, and I feel okay. What does this mean for me and my husband if I go into labor any day? And she's saying she couldn't see her midwife today for her checkup.
So again, it depends on where in the world you're living, but any sort of cough at this point would be, they should probably connect with their healthcare provider and likely be screened if they are pregnant. And it depends. For example, what we're seeing here in the United States, and again, I'm very US centric because that's where I'm based. We're seeing different policies from hospital to hospital. It's not even state to state, region to region, it's hospital to hospital. Some of them are allowing one person to come in, the partner or grandma, whoever it is they assign, and that's the only person. And some are saying no one can come in. And if someone does have COVID, either suspected or confirmed, they can have no one at the bedside other than their nurse and healthcare provider. So I can't tell them what it's going to look like. Their best, the best thing for them to do is contact their midwife who they're working with and ask them that question based on whether, the facility that they're giving birth in, what the current policy is. But here's the other thing. Policies are literally changing day to day. We have seen hospital systems that were allowing a partner and a doula, a certified doula, and now they're allowing nobody, and that's changing day to day. So yeah.
Okay. Yes, and I think, you know, the most sensible thing to do, even to protect other people giving birth and other people in hospital, is really to call them if you have any symptoms, to call your maternity unit and to let them know in advance before, you know, before just turning up if you are in labor. And I have a lot of questions as well about, you know, how many people can come in with me. I think like you said, it varies so much between hospital to hospital that people are getting very confused if their husbands can go in. A lot of people getting very upset that their partners can't be in with them. And a lot of questions from doulas as well, whether they're considered parts of the birthing team or not. So that's definitely a concern. And I guess it just really varies from trust to trust.
It varies from place to place, and the best thing is simply to keep an eye on wherever you're giving birth. They will have either a hospital or birth center website, and the majority of them are keeping a live COVID page that will keep their community posted on what their guidelines and their policies are and how they're changing. So they can keep an eye on that. They can also call the customer service line and ask about visitors. In all likelihood, it will either be only the partner or no one. Okay, there's a small potential that a doula will be allowed, but we're seeing across the country right now that has been significantly minimized. We strongly recommend that parents prepare for the fact that they may have not as much support as they had ideally wanted, by taking an online childbirth class, because obviously we are encouraging social distancing at this time, reading as many books on labor support, hypnobirthing, comfort strategies as they possibly can, and also preparing if they have access. Not everyone has access. How they will stay in contact with their loved ones when they go into their birth center or hospital, whether they're going to have a smartphone or a tablet or a computer, and making sure they know how to use the app systems, or like Facebook Messenger or Skype or Zoom, that they've mastered that before they go into labor, so they know
preparation.
Yeah, connection. Yes,
and
prepared.
I think preparation is key, isn't it? And I always say that, you know, people prepare so much for any other event in their lives. They prepare for their wedding, they prepare, you know, for anything big happening in their lives, but people don't actually really prepare for birth. They just turn up and hope for the best. And obviously, you know, if we just watch the Hollywood films, we are not going to be expecting the best, are we? We are going to be expecting a very painful birth and a horrible experience. And you mentioned hypnobirthing, and it's something that I actually really believe in, and I did for my birth. I had my first son at home, and hypnobirthing for me was a lifesaver. And I think there is quite a big stigma around it, and people think it's this hippie thing that, you know, and it's actually very, very interesting. It teaches you a lot about how your body works, and a lot around the positivity of the whole experience. And I was actually going to ask you whether there is any data, any research on whether, you know, doing this sort of preparation, whether it's hypnobirthing or something else, actually prevents any interventions. Do you know anything about that at all?
Yeah, so there's quite a bit of data over the years, and it depends on, some of the data is looking at very specific techniques for comfort strategies, but we do know that overall there is an abundance of data that does show that these sort of preparations, like learning how to do not specific breathing strategies, but controlled breathing that keeps your stress levels down, moving the body throughout labor, doing things like hypnobirth or hypnotic strategies, all can help reduce the stress levels, help the baby facilitate itself down the birth canal, and help increase the oxytocin levels and also the natural endorphin levels to keep the mother, the pregnant parent, more comfortable throughout the labor process. So there's a lot of data that does show that these sorts of techniques can be effective.
Okay.
But the key is you kind of have to practice them. You can't just say, yeah, you know what, I want to do that. And if you don't ever do any research or practice it, it may not be as effective as you want it to be.
And I've been seeing a lot of women going from I want a C-section to now I want a home birth. It's a massive jump, isn't it?
Yes.
And it's great. I think it's great. I'm a massive advocate for home births, but I think you have to prepare for it. You need to feel confident that what you're doing is the right decision. You need to read, you need to get the information, and you need to be prepared.
Right. And you also have to make sure that you are in a position to be a candidate for home birth. For example,
sure.
You know, there are some things that would put you at risk for not being a candidate. So, and again, that is regional. So state by state, and even some countries have a little different restriction on who is a candidate for home birth or not. So you would want to look up your local guidelines for that.
Right. So a few more questions about home birth. Some people are worried. They are actually booked in for a home birth, and they are worried now that they are not going to have that option due to high demand or to shortages of staff due to them being sick. Do you know whether government's actually encouraging home births or hospital births, or there's nothing around that sort of information?
So again, that's region by region. So we have heard of some provinces that are now no longer allowing home birth because they cannot, for a variety of reasons around COVID contraction. And then we are also hearing, for example, in the United States, there are some major insurance companies that are now paying for home birth as a result of COVID. So they're really embracing the concept because we may have our hospital system too burdened to have space for laboring individuals. So again, that's just going to be so regional. So you'll just have to keep updated on your province, state, country's COVID page about what they're doing. And the other way to kind of stay connected is to find the professional organization Facebook pages that govern those restrictions and follow those. For example, just kind of being in, I don't know, a family page around home birth may not give you the data for your specific area. But if you look up the organization that regulates those guidelines, that gets involved with the government to regulate those guidelines, you will have the most current data. So that you want to follow them.
Of course.
For example, here, it might be the American College of Nurse Midwifery or the Midwifery Association of North America. So you'd want to follow those pages.
Okay. Thank you. So if a person has symptoms, is there any information around what is safest, whether it's a hospital or a home birth?
So there's not necessarily guidelines on what is safest. My understanding is the current recommendations, if someone does have COVID, that they would be transferred into a hospital system.
Right. So they are properly monitored, and the fetus is actually monitored as well, I suppose.
Right.
And obviously, people worried about whether there are going to be ambulances, and that's impossible for you to say, isn't it?
It's just know.
And everything changes so quickly with COVID that at this time, I actually contacted my home birth team locally. I'm in Leicestershire in the UK, and they said everything is running as normal at the moment, but no one can guarantee anything because things just change very quickly.
Right. Absolutely. And I too am a big proponent of home birth as a safe and effective manner of giving birth for people who are in low risk categories. So but there, and again, regionally, we are dealing with situations we've never had to consider before.
Sure. And is there a safe distance from hospital if someone chooses to have a baby at home? Should they be a certain distance, or does that vary as well, again, from country to country?
Yeah, that's really going to vary. Most, and again, it's going to depend on the complication for transference, whether you also want to consider, are you in the middle of winter? Are you in the middle of, are you in Australia where there's no sun or road issues? So these are all things you have to take into consideration about your pregnancy and what stage you'll be at that time.
Sure. Right. And again, the other thing that I think people can do, even if they're not having a birth at home, is try and stay at home for as long as possible during labor. And that's regardless of COVID, isn't it? It's just a thing that, it's safest to stay at home for as long as possible, and in an environment that and you feel safe and comfortable, and then go to hospital when you actually do need it.
And if you have a doula, your doula can be with you at that time, provided that you are not symptomatic, right, with the virus. So, but that is an absolutely great recommendation, because when you're home and you're comfortable, your hormones and your oxytocin and your endorphins flow at greater levels, so you can get the progression of labor moving quicker. So yes, stay home as long as you are comfortable to stay home. Mm-hmm.
Perfect. So just jumping on to...
Oh, sorry. Can I add one more thing? It's also a really important conversation for you to have, whether you're having a telemedicine or an in-person visit the next time you're with your midwife or your healthcare provider, to talk to them about the eventualities. What will happen if the hospital does not have enough beds? What is the plan right now? Is there a birth center that we should make sure our records are going to, so that we can get registered there as well? Are you making recommendations potentially for home birth for the healthy patients? So it's a good idea just to have that conversation with your healthcare provider, because they should be up to date of what's going on in your most local community and tell you what the plan is as far as they know right now, right? So have those conversations. I do know that we are seeing a lot of families shift from hospital birth to birth center birth right now, or birth center to home birth, or they're also registering at multiple hospital systems in case one is too busy, they can be transferred to another. Mm-hmm. So just plan things out.
Yeah, and that was actually one of the questions. Someone was saying they were worried that they wouldn't be able to have a birth plan anymore because there's so much, so much change going around, and they won't have any control of their birth. So I guess there are some things that you can have control, and that's the sort of conversation that you do have to have in your antenatal appointments. And it doesn't need to be in person. It might be a telephone conversation, and that sort of discussion is very, very important, isn't it?
Yes.
Right. So let's jump onto postpartum now, Laurel, because we have been talking for 50 minutes already. So it's going very fast. So let me go to postpartum. So a lot of people worried about the little babies, whether they are, how vulnerable they are, and how likely a 1-month-old is to get sick, and what symptoms they will show if they get the virus, and also how can they keep them safe.
Okay, so these are good questions. This is where there's a lot of very good news. So we right now know that we cannot identify in data vertical transmission with the cases that have been published so far. And vertical transmission means from the pregnant parent to the baby in utero. So we don't have evidence of that sort of contraction. And we also know that one of the best things you can do to promote the health and safety of your baby is to breast and chest feed them, right? And there's a variety of reasons for this. And right now, all of the international guidelines, the local guidelines, everyone is on board with this, that human milk is the best thing for babies in this situation. And we have no data to show right now that COVID-19 winds up in human milk either. Now, in the United States, unfortunately, our Centers for Disease Control are recommending if somebody is confirmed with COVID-19 that they are separated in the room with their baby at least 6 feet, and they're only holding them to breastfeed with personal protection. And that's a little different guidelines than what we're seeing from UNICEF and the WHO.
Yeah.
I think that there's this worldwide acknowledgement of how important skin to skin is, and being in contact with your baby for self-regulation and brain regulation and hormonal regulation, and milk supply as well. But one of the things that we want to remember is that human milk has so many important aspects to it. It's not just the fact that there are immune factors in it that are going to be protective for the baby against not only COVID, but other illnesses and pathogens, but also there are other active factors. For example, there's something called cytokines, and these help with inflammation in the body. There are bacteria that is unique within human milk that helps to create a very specific microbiome in the baby's gut that protects against pathogens and creates a really healthy mucosal layer in the gut, so that even in the event of infection, it's less likely to cause significant issues within the baby's body. So human milk is almost like its own little vaccine for the baby. The other
fascinating, isn't it?
Yes. The other good news is that around the world, the data from around the world is that babies and young children, even if infected with COVID, seem to have very, very mild symptoms. So in all of this, our worries around the babies are primarily focused for me on the fact that we may be enforcing separation when not necessary, and of course if the mother is too ill to care for her child. So but breastfeed if you possibly can, breast and chest feed. And if the parent is too ill, has to be separated for her own medical care, it is still recommended to support breastfeeding if possible, bring the baby to the parent, or help her to express, and a healthy person would then provide that express milk to the baby. So we do have some kind of really some good news here around that.
That's great. Yeah, we are in need of good news, so that's
Yes.
pretty good to know. And someone is asking, so actually linked to that, to the previous question about how to keep them safe. Obviously, breastfeeding is the biggest thing, but the other thing people are asking here, how much time after they go home can family visit? And I think that's another factor to keep them protected, isn't it? Just, it's not just in the hospital, it's to keep them isolated for that initial period at home. Without visits, and as sad as it is for grandparents not to see them, it's a risk for the grandparents as well, isn't it? Coming from hospital.
Absolutely. I would encourage connecting with family members the way that we're connecting now, in an online format, so you can see faces, you can show them the gorgeous little baby. Grandparents can sing lullabies to the baby over here. They can read them stories. I know they're newborns, but babies love to be read to. So there's a wide variety of things they can do other than being in physical contact with the parents, as while everyone is in this period of self-isolation.
Sure. So I think that's the main questions about postpartum. I do have some more general questions. So someone asked if they have had already the virus, can you get infected again? I'm not sure whether there is any data on that.
So there was one case study that did come out of China of a COVID case that they suspected was a reinfection, but it has not been confirmed. But there's been no other case studies or data around that, so it is unknown at this time. it's unknown.
It's very early on, isn't it?
Very early
we just don't have
on,
sufficient.
right.
So just going back to the previous questions about the newborns, someone is asking here live, will baby show no symptoms? So do we know whether, I think the information that we have at the moment is that they show quite mild symptoms, isn't it?
They may be completely asymptomatic, or they may show some mild symptoms. Yeah.
Okay. Okay, so now going on to the doula questions. Someone is, obviously we know that it has been, you know, it varies a lot from country to country, from hospital to hospital, whether doulas can attend the birth as an extra person or not. And so someone was asking here whether there is anything legally that they can do to ensure that they are considered part of that birthing team.
Not necessarily legally, but you can look to your nursing and medical organizations to see if they have published data about the importance of the doula in the role of birth. Here in the United States, both our ACOG, which is our Association of Gynecologists and Obstetricians, and our Association for AWON, it's the Association for Women, I can't think of, it's basically the Nursing Association for Obstetrical and Neonatal Nurses. They have published a statement about the importance of doulas for the health and safety of families and as part of an integrative team. And they've also made a specific statement about why they believe that doulas should be considered part of an essential healthcare team even during COVID and not restricted from visiting. Now, so there are a few things to do. DONA has actually created a toolkit for doulas that is downloadable on their website. If you just go to dona.org and click on their COVID page, they have a toolkit, and which is super helpful for doulas to think about what to do with your clients ahead of time, how you can provide virtual support, what it might look like for you to change support in the postpartum period, how to keep yourself safe, all really good information for them. But they also provide a letter of statement for them to take to the hospital to identify themselves as a doula, bring their certification page. If they have a badge, that's a great thing to bring as well. And then also, like the Childbirth and Postpartum Professionals Association, they can provide badges and certificates of certification. So so check with their certifying organization for their recommendations, and also check with the organizations to see if you can download any of that information ahead of time to take in with you.
Perfect. And someone was asking how to keep safe as a doula, and also as a doula attending many births, how do you ensure that you're not putting the families that you are supporting in risk?
So if you're a doula and you are planning on attending birth, you should be using the same sort of guidelines for personal protection equipment as any of the other medical health professionals. So you would want to make sure that you have a mask, that you have gloves, that you are wearing clothing that can be either disposed of or immediately washed upon leaving. Your hair is back, preferably your hair is covered. So you should be protecting yourself just like any other healthcare provider. Ideally, you would also want to make sure that you bring a change of clothes. So as soon as you leave the hospital, that you change before you get in and put them in a closed bag. Get into your car and clean clothes. When you get home, immediately shower, wash all those clothes and put on fresh clothing.
So guys, I'm so sorry, but I didn't realize that the live video would cut off at 1 hour, and we've been chatting for 1 hour. I didn't even realize it being that long. Let me just see if Laurel, hello Laurel, we've been cut off because we've been talking for too long.
And so we can finalize. We've been talking for too long. It has been a whole hour that we've been chatting, and obviously I didn't know that because I'd never done a live video with someone else, and not for that long, obviously. So obviously Instagram cuts it at 1 hour. So just to finalize about the safety of doulas.
Yeah, so and they will also need to make their own intuitive and gut decisions about whether they will attend birth if there's a suspected or confirmed case. So they may want to, at that point, provide telesupport. They can be on a live feed on an iPad or, a tablet or a smartphone instead of being in person. They can still provide guidance to the family, suggestions for positioning, if they want to get in the shower, things. So they still can be a step-by-step guidance. They may just not want to be in person if there is if someone has contracted the illness. And they just, they should employ best practices and safe practices to protect themselves and their family, as well as providing the optimal support to their families, their contracted families.
Sure. Excellent. And that was another question about, what are the other things that doulas can do in terms of supporting a pregnant or postpartum woman if they can't attend the birth. So I think you've mentioned already that, one of the things is that they can be at home with them during labor if, neither of them are symptomatic. So, and the other things are providing the online support that you mentioned as well. So there are several things that they can do.
Absolutely. And there may be some things that were not necessarily in their contract before that they may want to provide. For example, they may want to, while the family goes to the hospital, if they can't go with them, cook them some more meals, some ready to prepare meals, so that as the family comes home, that they have nourishing food right off of the bat. They may be able to do lactation support if they are trained in that, or do some postpartum care for the family when they return home if they're not invited to the hospital because of policy guidelines. And they can also do parenting classes, prenatal classes. There's a lot that they can do to support the family that may have been in their package, but may now be part of an add-on that they will include if they can't be at the birth. So we can get really creative. And that toolkit also from Donna has a lot of these suggestions. It's an excellent guidance for doulas at this time. It's a free download.
That's good. If you could later just leave us a link as well, that would be fantastic, because if people can't understand it. And the other thing that I was going to mention is, if I have read somewhere, and I can't quite remember where now, but I think it was some sort of guidance for doulas saying that if the birth partner, so the person's partner or whoever is accompanying them at the birth, has symptoms, then obviously they won't be able to attend the birth. And I think that's the policy for the majority of the hospitals. So for anyone who had been considering a doula and now are not anymore because of the restrictions, it might be quite useful to have one as a backup, or to at least consider who else might be able to attend the birth with you if your partner does have symptoms.
Absolutely. It's very important now more than ever that doulas do have backups, that you're creating those relationships within your community to have a backup. Even if, what if the doula herself is?
Yes, of course.
Support, even over the phone, you would want to be able to have another doula who could provide the telesupport. So absolutely, it's critical right now to make sure that we can care for our families in the best possible way, considering the situation.
Perfect. So that's all for now. I think we've covered the majority of questions. I had to skip through them, so I might have missed one or two. Apologies if I did, but I think we did cover at least all the stages: pregnancy, birth, and postpartum. So I just wanted to end it with a positive note, because all we hear is all the bad side of COVID. And one of the positives that I think, and that I've read in other places as well, is that obviously with the isolation and lockdown in some places, partners are at home now, so they are more able to be part of this gestational period, to be part of your pregnancy. And sometimes you know, women or pregnant women are going through this very much alone and feeling very lonely. So you can have that support from, if you do have a partner, and obviously to have that that support afterwards as well in the newborn stage, which is so hard. And sometimes all you get is 2 weeks. I'm not sure how much you get in the US, but here in the UK, it's 2 weeks paternity leave. I know in the US, maternity and paternity leave is not great. But here in the UK, you don't get any at all. So obviously with partners being at home at the moment, even if they are working from home, at least they are there present and can be part of this moment that is so important in the life of a couple, isn't it?
Yes, and I think another piece of positivity we can pull from this is that since many pregnant families are now at home doing distancing, or sometimes ordered to stay at home for a period of time, we now have some additional time to do the education that we may not have had time or been too exhausted for if we were, you know, working full time outside of the home. So it gives us some space and opportunity to explore books that a lot of the libraries are now offering free access to online published books. And a lot of those are really wonderful birth and parenting and pregnancy books. And there are also free online classes that parents can take. You have an opportunity to do meditation or prayer throughout the day, do prenatal yoga or prenatal exercises at home and move your body, do deep breathing activities. And it is absolutely a time to connect with your partner and talk about what you want parenting to look like, and do some big imagining for the joyful journey that your family will have as we move on from COVID. This is a short, hopefully, period of time in the world, and you can make some big and wonderful plans for what your family will look like in the future. So there are some things that we now have an opportunity and space to do that we may not have had before.
That's great. And as you mentioned, connecting with your partner, it did remind me of two questions that I missed. Actually, one question, but several people did send the same question about trying to conceive and whether they should continue to try to conceive, or it's best to wait a little longer until we know more.
Well, that'd be a really individual
decision.
And, you know, a lot of factors would play into that, you know, a lot of factors. I wouldn't want to make a recommendation on that, because that's a really personal decision that a family would have to make. Mm-hmm.
I think a lot of people are worried about financial situation with the instability that we are living, but also on the other hand, we have all this time in our hands. We are all at home, stuck at home alone, and you know what best to do than trying to make babies. So
we might have a baby.
I'm not really sure. Obviously,
months, yes.
Yeah, people have been talking about this. Okay, thank you so much, Laurel, for your time. I'm sorry for taking up so much of your time, but this has been really useful, I'm sure, to a lot of people, and it has been great to talk to you. Thank you very much.
Absolutely. Absolutely. Thank you for inviting me.
No problem at all. Bye. Thank you, everyone. Bye-bye.